Given the rising food prices and even unavailability of some basic foods, many people are increasingly consuming a single diet. In most instances, people now only consume carbohydrates and starch foods like potatoes, rice, and flour-based foods. Accordingly, people are not eating balanced diets and thus lack the nutrients they need for a healthy living.
Persons are not having sufficient milk, meat, or eggs, especially the poor, and we need to give them some of these nutrients. And the way that we are planning, or we have already done in many countries, is to put in these nutrients into the foods that we usually eat, like wheat flour, maize flour, sugar, or salt. We use those commonly eaten vehicles that are poor in micronutrients that then can carry these important nutrients.
For those living in urban areas, consumption of processed food has become the norm, but there is need to return the micronutrients like vitamins, iron, iodine destroyed during food processing. Thus, they need to begin embracing other strategies of returning lost micronutrients and carb deficiencies that occur as a result. One of these strategies has been identified in the world over as food fortification.
Then, really, we should actually be running towards fortification, not just walking. Look at iodine deficiency. We are talking of a child being born with mental retardation. We are talking of a child who can't have his brain well developed because he's lacking this mineral.
There is the issue of finalizing the model standards.
Food fortification involves adding the desired micronutrients to food. This means that nutrient-rich food is delivered to large segments of the population without requiring radical changes in food consumption patterns.
It works if we have a very wisely designed program. Food fortification should supply what is needed, and that is why the researchers should tell in each country is different, which are the deficiencies, and then when we know that, we can put those nutrients into the foods. And what we are doing is really trying to make our diet the best that we can, accordingly with our knowledge.
In Kenya, salt was fortified with iodine in the 1970s. This alone has dramatically reduced the number of goiter cases in the country. But 36 years later, the focus has mainly been on the flour, oils and sugar industries.
We have moved now to flours, and in the flours now, we have developed the standard, and we have like 3 to 4 industries who have taken up fortification. But we need to move a little more and expand to the remaining millers, because we have about 21 large millers or mid-sized millers whom we should work with. It's a little difficult to work with the very small millers, because then the processes actually need bulk milling.
Fortification has been used for more than 80 years in industrialized countries as a means of restoring micronutrients lost by food processing, particularly because of the growth in consumption of processed food.
There is interest from some sugar industry to fortify sugar with vitamin A, because again sugar is widely consumed and it can reach a large proportion of the population.
Fortification, it is an industry-based intervention, but that should follow public health principles. The main regulator and the main supervisor of food fortification is the public health sector, especially the Ministry of Health. But they don't produce foods. Those are produced by the industry.
But for the government, we have a responsibility of developing now the standards, because we need to guide industry. How much micronutrient should they add to this food? In what level, so that we don't add too much so that it causes problems, or we don't add too little so that it doesn't have impact.
Zipporah Karani for KTN Health Digest.